Hello and welcome to our first ever podcast series of HTAi. Today we have a very incredible guest, a proud alumni, a very good friend, and my confidant, Preet Shah. Thank you so much for coming here and doing this with us. You were one of the reasons why I chose Hofstra, not many people know. So I'm very glad that I have you. And as a friend and as somebody who always looks up to you, I'm super glad of where you are today. Would you like to tell something about yourself?
Yes, my name is Preet, 24 years old. I am a brand new alumni and a fresh graduate from Hofstra University. Just finished my master's in health informatics, and yes, it's been 2.5 years in the States. It's been a good journey so far.
That's wonderful. So, we did our bachelor's together in optometry. So, would you like to share why you switched from clinical to tech?
I think it was during the time of COVID-19 where we all were at home, and my parents were much more keen that after finishing my graduate program over there, I should go for my further studies somewhere. I had plans of going to multiple countries. First, I was planning to go to Australia, then Canada, then finally I came to US. But then when I was inquiring about what are the good programs to do, then my family, friends, my mentors, they told me that if you are coming to US, make sure you are doing something with health and technology. So that's how I landed up in health informatics.
That's really wonderful. I'm sure there are a lot many students like us who switch from clinical to tech, and they're very confused when they come in our program. And your story is one of the most inspiring stories for a lot of students who are looking to pivot. Coming to Hofstra, how was your experience with Hofstra, and how did you land up with Hofstra?
I think that was one of the best experience, one of the best university life I ever had. I was pretty much sure that when I started my research journey for choosing the course and program in the university, my education consultant or the counselor was much more keen on going to the best city instead of the best university. He was like that if you go to the best city, you land up high opportunities for getting a good job. So when I searched for New York, universities in New York, so Hofstra was one of the first university which came and which highlighted that the health informatics program over here is a STEM designated course.
Right.
And just because it's hardly 20 minutes away from New York City and highly convenient for everything, and we also know that New York has the highest Indian diaspora in the States, so that was one of the reasons why I chose Hofstra.
That's great. Do you have any fun memories of Hofstra that you would like to share with us?
Yes, a lot of fun memories. I think it was from the day one when we were highly involved in college.
Right.
And were, I think not only in academics, but we were active in co-curriculars.
Right.
One of the best fun memories that we used to always have a fall festival in the month of September and October where there used to be concerts and a fair and all the rides used to be over there.
Right.
So those were some of the few fun memories which we used to have.
Right. So as you mentioned that you were quite very involved on campus, and I know because you were my mentor. And apart from being a mentor, you were also involved. You also had a grad assistant position. So do you want to share of how did you land up with all those positions in Hofstra?
Yeah, so when I came here in August 2022, September 22 was the time when the university started.
Right.
And Hofstra being a bigger university, they had the best opportunity was that they had good positions for student assistantships. So on the website, when you used to look for campus opportunities, so
Right.
graduate assistantship, research assistantship, and teaching assistants was one of the few things which we international students always look for.
Right.
So then I applied for multiple positions, and then one of the department was teaching, learning, and technology, where I got this particular position, and I was there for 2 years, closely 2 years.
Yeah.
The best part was that they almost paid 70% of my tuition fees over there.
That's amazing.
Yes.
You know, as how Hofstra has a grad assistant and a grad assistantship, would you like to differentiate between the two of them?
Yes. So a graduate assistantship is a type of scholarship wherein every semester, how much of a credit you take, the department where you are working is responsible to pay for 9 credits. So out of, if suppose I take 12 credits in a semester, so for 6 or 9 credits, the department pays the fees. So this is, and you get a basic monthly stipend. Whereas for graduate assistant, you are on a specific hourly wage where you have to work on particular projects.
Yeah, absolutely. Do you also want to share on how can one navigate through, finding jobs on the Hofstra portal?
So the best way is that Hofstra usually posts all the jobs on their application called Handshake.
Mhm.
All the student aid positions or the hourly positions are posted over there on regular basis.
Right.
Apart from that, to look for graduate assistantship, when you go on the Hofstra website, go straight down to the bottom and they have a tab called job opportunities.
Mhm.
Once you press on that tab, they have two options. One is job opportunities for employers and second is graduate assistantship for students. So over there all the departments usually post their openings.
Right. So for say if there's a student who is planning to join Hofstra in fall 2025, I would say, what are the pre-preparations that one needs to do in order to get an on-campus job?
I think the best thing is that first to make sure that you have a complete profile of yours which is ready. It is your resume, it is LinkedIn, your cover letters, your
Right.
statement of purposes, and all your achievements. Once you
Mhm.
have all the things in the place, you can start applying on all the positions. And the best thing which I prefer and I did was my for example, I was from a clinical background, so I made sure
Right.
that all the clinical faculties and professors in the Hofstra, I took their emails and I sent a bluff email to them that I
Yeah.
saw an opening in your particular department and I'm highly excited to work for that particular role.
Yeah.
So few of the professors did reach out to me that yes, we have, but in other way, I think the best thing is that once you land over here, I personally prefer to go to the department, meet the specific
Right.
the hiring manager or the supervisor who is present over there, and
Right.
then you can contact them.
Right. Thank you so much for sharing because I think that was one of the
Yes.
best advices that you gave me when I was preparing for coming to Hofstra and joining. So thank you so much for sharing those insights because not many people know, not many mentors are aware of this fact. But also, you were one of the global mentor. You were my global
Yes.
mentor. Although we are like very good friends, but you are somebody who helped me in each of the step. Do you have any fun memory from your position as a global mentor?
I think the best memory of being a global mentor is the nostalgia when you
Right.
when every time a new student comes to the campus and the situation every student goes through. So that's the
Yeah.
kind of nostalgia which you get it after you become a global mentor.
Yeah.
Because you see that there are hundreds of students who are going through the same journey where you are going through, and you know that you have to guide them and make sure that they are not doing the mistakes which you have done it before.
Right.
Yeah.
Yeah, absolutely. I agree. I remember when I first came, I started crying, and then I reached out to you,
Yes.
and then you told me, let's just take a view
Yeah.
of the campus, and that's when I knew that,
Yes.
okay, I cannot like go back. So thank you. You were one of the most greatest mentors that we've ever had. Coming to your internship. So you did your internship in Northwell for your third and your fourth semester.
Yes.
Would you like to share how was your experience working as an intern?
Yes, so I think I had one of the best experience with Hofstra's Northwell practicum, because so how does this start? So once you come in your third semester, the professor will reach out to you and they will ask for your areas of expertise or the places where you want to work. So I was highly inclined to work in either analytics or informatics side. Then I had an interview with my manager at Northwell, and then in the beginning of the September I started working with her. The best part was that my manager was the lead medical informaticist at Northwell's ambulatory department. And during my time of internship, Northwell was switching to a new EMR called Epic, and I was working on the implementation side. So I think that was one of the best internship experience, because for the one whole year I was working on Epic applications for ambulatory, and since I was from optometry background, so I also had a chance to work on my ophthalmology application.
Yeah, that's great.
Yes.
Now that you've mentioned that you were working on Epic,
Yes.
and Epic is such a talk of the town
Yeah.
today, would you like to share of how Epic has its own personality?
I think first I would say that majority of the hospitals in the states are using Epic.
Right.
One of the reason because it is highly integrated application, and secondly the kind of applications which Epic offers to the physicians, it is highly user friendly, and with data point of view they have a very nice analytical solution which is very useful for all the insights and the data points which are used to map for any organization.
No, absolutely, I agree. So you had a very great opportunities when it came to internship. Do you have any Preet Shah ways of how did you ace your internship interviews, or how did that go for you?
I think for anything which you want, curiosity is one of the things which you always have to show, eagerness to learn, and there always has to be a what and why for everything you do, and what you are trying to add or what value you are giving to the organization or the team. I think if you have all these things checklisted, so the manager will also realize that this particular student or this particular candidate is highly efficient and willing to learn. So this is how you get all projects and you get to work.
Yeah, that's absolutely correct, and that was very insightful.
Yes.
You know, we are international students. We come from a country like India. So, what were the challenges that, as an international student, you faced when you first got here?
I think one of the biggest challenge which every international student faces is housing,
Right.
because that is the biggest challenge. For me, it was why it was housing for me, because I had no one of my family over here.
Yeah.
So I didn't knew that what houses we have to go for, and not much of my seniors were in this particular town. So I
Right.
think except housing, I didn't have any much other issue.
Right. Of
Yes.
course. Did you face any cultural shock, or when you were here, you found that it was quite surprising to you, or something that took you off?
I think that was one of the things why Hofstra was the best choice, because till
Yeah.
date in the last 2.5 years I had no bad experiences. People are highly accepting over here.
Right.
And the best part is that the culture over here is in such a way that you dwell and swing in the culture by yourself,
Right.
and you try to appreciate things around yourself. So I think that is one of the thing why I didn't have any cultural difference. And also, once you realize that you are not the only one alone in this journey,
Yeah.
all other international students with you are in the same boat, so
Yeah.
that becomes easy for yourself.
Absolutely, I agree. When I also came here,
Yeah.
I had your support, of course, because I knew you back from India. But of course, when international students come, the fact that they have so many people around them who are just like them, who just as equally struggling like them, I think it definitely balances out.
Yes.
Speaking of the cultural differences, you know, you practiced as an optometrist for good 2 years back in Bombay. You were in the clinical side, and now that you are a quality analyst, we will get to that later
Yes.
part. But what difference do you feel, or did you find from back in India when it comes to clinical versus here?
I think India being a densely populated nation, volume was one of the things which I realized is
Yeah.
the differentiating factor. Back in India, when we were working as an optometrist
Right.
over there, in our hospital, in our optometry school, we used to screen 80 to 100 patients every day.
Yeah.
Over here, since the population is not that much,
Mm-hmm.
so it's more of quality over quantity.
Right.
And I think the second thing is it is much more research oriented over here.
Mm-hmm.
Back in India, it was more of doing the right thing at the right time, but since here you get an opportunity of time,
Yeah.
because the volume is not that much, so you can spend more number of hours on research and clinical studies.
No, absolutely. I absolutely agree. You know, speaking, this question is from all the international students out there, and for myself, of course. Do you have any homesickness? Do you feel homesick? Or if you do, how do you cope up with it?
I think, to be very honest, I was super blessed with the people around me. So I had, like, till date in the past 2.5 years, I didn't have any single day where I felt homesick or I want to go back. No matter, like, when
Yeah.
when I visit my home, it is little bit hard to come back. But
Yeah.
apart from that, from my point of view, I didn't feel homesick. But one piece of advice which I would like to give is that surround yourself with like-minded people,
Yeah.
and make connections in such a way that it is not only professional but even personal,
Right.
so that you have a sigh of relief that you have someone to count on, and
Yeah.
you can rely on someone.
No, actually, having friends in a country where you
Yes.
don't know anybody is such a big blessing.
Yeah.
And of course, you are one of my friends,
Yes.
and you are one of my blessings because you actually balance things out. So yeah, of course, having good friends really does wonders to you when you are in a
And-
foreign country.
And also, I think that if you have a sense of purpose, that why you are over here, so I think that is one of the driving force which keeps you going throughout all the phases of life.
Right, of course. So you recently got a job.
Yes.
Would you like to share something about how did you land up with that job and what do you do?
To be very much honest, I started my job. I graduated in May 2024, and I started my job applications back in September of 2023 when I was in my third semester, which was the fall semester.
Yeah.
Because based on the current industry trends and the market situation, I thought it's better to start early. So I made a point that I applied to 20 to 30 jobs every day in the initial phase for the first few months. Then in the winter break, I went home. So for 2 to 3 weeks, I didn't apply. But when I came back in January, and I know that I was graduating within 4 months, so I made a point that I have to apply to 40 to 50 jobs every single day, Monday to Sunday. Go to all networking events, all the career fairs, to speak to all professors, reach out to your alumni, reach out to your batchmates. You have to make sure that your resume or cover letter is being circulating every day to all different organizations.
Right.
And then in the month of March, I got an interview call from Stony Brook Southampton Hospital. And in the month of April, I had my first interview. Then in the next 2 weeks, I had my second interview. And then in May, in first week of May, I got an offer letter from there. So I think it was a 2-month whole process of onboarding and everything. So I got hired as a quality data analyst over there, and it's been 6 months. I started from June. It's been 6 months. It was a good roller coaster journey.
That's wonderful. I remember being all the part of it.
Yes.
But I know how excited, how thrilled, and how nervous it was to get your first job, when people are struggling. But I'm sure all the hard work that you put in from good 1 year totally paid it off. So as a quality data analyst, would you like us to take through the day of how your day looks like as a quality analyst?
So since I work in the quality department of the hospital, so my department, we are responsible to make sure that we are following, tracking and trending all the government guidelines and regulations by different regulatory bodies like the Joint Commission, CMS, Center for Medicare and Medicaid Services, and there are different hospital ranking surveys which we have to go through. So my part of journey that I have two different responsibilities. My hospital where I work, our hospital is a level 2 trauma center, and that is being verified by the American College of Surgeons. So every year in the month of April, they come for recertifying the level of the trauma center. So every trauma center have their clinical guidelines which is to be followed. So my responsibility is to make sure that I am tracking and trending all the clinical guidelines and to make sure that we can find areas of opportunities and improvement. This is one part of job. Second part of job is that our hospital has a big analytical solution and we use a software where all the data has been fed. So I work across the house, every department, if they have any particular data request, if they want to pull any report, say for mortalities, length of stays, readmissions, social determinants of health. So it's my responsibility that I create the script and I pull the reports and find areas of improvement.
That's absolutely incredible, because that's something similar to what we as health informatics students study. So for us to study it and put it together in a real world is absolutely life-changing, or it's absolutely very fruitful, because not many people who study the same thing gets an opportunity to implement it in their career and in their day-to-day life. So speaking of which, did you have any challenge in any particular project that you did, and you face any challenge, and how did you overcome it?
Project as in challenge was one of the greatest, I would say, or the biggest challenge which we had for any project was to make sure that the data which we are gathering is validated, or I would say, is the data correct or not. I think that was the biggest challenge. Cleaning the data is always a big task, and that is my responsibility.
Are there any particular trends in IT or in health informatics that you think would be a game changer?
I think, as we say, that information is power. So any prediction projects which you think, or any predictive model or anything with respect to data science is something which is in trend right now. Because if you have any piece of information a day before than the world has, then I think that is where you win.
Right.
So anything with predictive analytics is the future right now.
I know a lot of international students, of course, it's me as somebody who will be graduating soon. I have a lot of these questions, and I'm asking from behalf of all the other students. What are the recommended skills that one needs to have in order to ace the health informatics job market?
First, I would say a strong clinical vocabulary. I think
Mhm.
that will be added advantage whenever you land in this particular field.
Right.
Second is basic analytic skill. If you are back in India or any of your home country, prior learning of Excel, Tableau, and little
Mhm.
bit of statistical softwares like R or Python.
Mhm.
And then once you land up over here, you can start with your certification courses and do multiple projects on any particular specialty.
Right. Now, as you said, certification courses.
Yes.
Would you like to recommend few of the platforms that one can go on and take these certification courses?
I would say that all the big universities like Harvard, MIT, and
Mhm.
Stanford, they have free certification specifically for health analytics.
Mm-hmm.
So apart from that, you can also do LinkedIn Learning, Coursera, and Udemy. And
Right.
you can also participate in all the hackathons which are being run by Code Basics, Code
Mhm.
Academy, data camps. The more you expose yourself to all these particular sandbox environments, the more you
Yeah.
will be better in these tools.
Right. And, I know there's this one very famous quote that you always quote saying that network is your net
Yeah,
worth.
definitely.
So, would you like to share some of the networking tips and how one can, build connections or build networks here?
I think the first step is that just have a basic conversation with everyone you speak, and not with an approach that he or she might help me in the future.
Mhm.
Try to help each and every person in your nearby surrounding. You don't know that where you will land up.
Right.
Apart from that, go for all the events in the university.
Mhm.
Speak with all the professors, all the students, all the alumni.
Right.
Choose specific organizations. Like, for example, I am part with Hofstra Future Healthcare Leaders. I'm
Mhm.
part with Healthcare Leaders of New York.
Mm-hmm.
I'm a member of American College of Healthcare Executives, where you
Yeah.
know that all the, I would not say senior positions, but
Yeah.
all the people of the field across the state or the
Yeah.
city will be at one particular place, and you can just never say that I want to land or I want to go in this job. Always share your experience that this is what I have worked on.
Mm-hmm.
Because not every time you will be meeting the person
Right.
for the particular job you want to work in. But if you have diverse experience and you just share your experience,
Mm-hmm.
maybe he or she can connect you with the right person.
Yeah, absolutely. The networking tips that you shared were something which also helped me when I go for, networking events or career events. Coming to the career events, even Hofstra hosts a lot of career fairs. What would you suggest students of how to prepare for that career event?
Have a good elevator pitch. Make sure
Mhm.
what you want to speak. Keep your story ready for your experience. Have your CVs or resumes formatted. Use
Right.
the university resources for all these things. Have your
Mhm.
cover letters generated properly.
Mhm.
And speak with every particular booth or every employer which is there in the career fair. Like, I can share one
Yeah.
experience from 22 onwards. Only from the very first career fair, there was
Mhm.
this employer who always used to be there, and I connected him for the first time.
Yeah.
He was there for the second career fair also,
Mhm.
for the third, and for the fourth time also.
Yeah.
And for the fourth career fair was the one when I had to graduate. And at that time, I told him that I'm graduating in few months
Yeah.
and I'm looking for jobs. At that time, just because we spoke for the last 3 times, he
Yeah.
told me that now you can take my card. Anywhere you apply on the company or on the company website, make sure
Uh-huh.
you use my name as a referral. So
Wow,
you don't
yeah.
know that what particular thing which will build up and which will be helpful eventually in future.
Yeah. Speaking of which, what are the other roles that health informatic people can apply to? Apart, of course, you are a quality data analyst, but there are just so many roles, it's just such a wide niche. So, what are the other possible roles that one can apply to?
Uh, I think the general positions which we can apply or which we can aim for is first is data analyst,
Mm-hmm.
then any sort of data analyst, be it quality analyst, performance analyst, regulatory analyst. Then second is clinical informatics specialist.
Mm-hmm.
Third is medical device technologist. Then not only that, but now since data and data science positions which are being booming right now,
Yeah.
so you can also go for data science positions as well. So these are the top 3 positions which you can always go for.
Perfect. Yeah, that is such an incredible input from your side. We're gonna do a very fun session. We are gonna play this or that. I'm
Okay.
gonna ask you, and it has to be like super quick. So let me know when you're ready, and I will
Okay.
shoot questions. Okay, so Preet Shah, are you ready for this or that?
Yes.
Okay. Data or intuition?
Data.
Python or SQL?
SQL.
Accuracy or speed?
Accuracy.
Visualization or raw data?
Visualization.
Work hard or work smart?
Work hard.
Precision or creativity?
Precision.
Mentor or mentee?
Mentor.
Thank you. That was a fun one. I know you would choose mentor for obvious
Yeah.
reasons. Okay, so coming to the later parts, what is that one advice that you would like to give the current health informatics students that they should take away from this podcast?
First thing in general, help everyone, because you never know that what or how someone can land up you with a good position or a good role. Secondly, open to learn, willingness to learn, have curiosity. Thirdly, that now if you know that you are into it, make sure you are 100% into it. Explore all domains of health informatics, not only health informatics, but speak with people from all particular departments, be it public health, health administration, research and epidemiology. Thirdly, I would say that work on multiple projects. The more projects you do, the more proficient you will be, and you will have different skills and experience in that. And lastly, I would say collectively network and speak with everyone.
Yeah. So you know how many people don't go up to people and talk because they're very scared or they're very shy. So for people like that, would you like to give some advice that which will encourage them to go and start networking, or at least start an initial conversation with them?
I think the best thing for that is to force your friends to go, and sense of humor point of view, make a plan that you will go with that particular friend, and at that moment just cancel out that you are not going. So by hook or crook, he or she might land up going alone, and they will communicate with the people. And thirdly, before speaking to anyone, just make sure that what value you want and what value you want to add. It is always a two-way communication. If you want to learn something, you need to teach something.
Right.
So always be happy to share experiences. I think that is the best way to communicate with anyone.
So I know you are somebody who has always been like super involved. I know you since your undergrad days. There also you were super involved, and Hofstra you were involved. So I just want to know, apart from your curricular journey, as you have multiple involvements in clubs and you hold so many positions, how did that shape you in your professional life or in your professional role?
I think that was one of the reasons why I landed up with this particular position. Secondly, I will share you an experience. When I was working in school for my graduate assistantship, so my manager, her daughter had a baby and I had to gift her something.
Okay.
So I gifted her a book, and that was something which was for moms.
Okay.
And then when I was going for my interview for Stony Brook, over there I was researching about my managers and directors over there. So I got to know that one of my VP over there, she was the author of that particular book.
Okay,
so when I
that's
went
interesting,
for the interview, she started asking me questions, but I interrupted her and I told her that before starting the interview, I would like to say you that a year ago I had this particular occasion, I had to gift someone this particular book. And then a year after, when I got to know that it was you, so that was one of the key things, and that was one of the impressing points during my interview.
Incredible.
And not only that, when I was in India, I was searching for people on LinkedIn who went to Hofstra University. During that particular time, I found this person. His name was Dr. Vishnu. And I texted him on LinkedIn that I got offer letter from Hofstra University. I'll be coming for this particular program. And I think that was a blank text which I left among
Yeah.
hundreds of other people.
Yeah.
In 2022, in 2023, in my
Mhm.
spring semester, I had this course called Clinical Decision Support System.
Yeah.
Over there, for one particular day, we had a guest lecturer who came
Mhm.
and he delivered the lecture. And then I thought that let's connect with him on LinkedIn because
Mhm.
he was director of informatics.
Yeah.
So when I searched his name, I got to know that he was the same person I texted a year ago.
Oh.
Yeah, so I told him that this was the
Yeah.
story. And I don't know what went well or my stars were aligned,
Yeah.
but my internship manager,
Mhm.
she was directly reporting to Dr. Vishnu. And throughout my internship
Wonderful.
experience, I was shadowing under him.
Wonderful.
So this is how networking, or I
Networking
would
works.
say, will just take you.
Of course. And now that you've said LinkedIn, like many people are on LinkedIn and they're clueless in how to, build networks or how to send cold emails. Would you like to share some tips on how one can build their profile on LinkedIn?
Jot down all the experiences which you have, all your
Mhm.
achievements which you have.
Mhm.
Be regular on LinkedIn. Reach out to people from the same industry, same university, same state. Don't be specific that I only want to connect with this particular people or this particular person. Connect with everyone, speak with everyone,
Mhm.
indulge in conversations. Now, LinkedIn has a system of share your contributions, so make sure you
Yeah.
share your contributions over there. Join in all the specific data clubs or informatics club,
Mhm.
and I think every point you just grow and you learn and
Yeah.
you make mistakes.
Absolutely. Uh, would you like to sum up your entire experience that you have until now, be it clinical and now that you've switched to tech? What is some one take that, or what is that one learning that you learned that you apply or you look forward in applying to all your future endeavors?
So I think the one line which I would like to say is that be proactive instead of
Mhm.
reactive. Don't wait for any opportunities to come. You have to
Mhm.
find your own opportunities.
Yeah.
Thirdly, be highly curious to learn. Always
Mhm.
have a what and why for every single thing.
Mhm.
And fourthly, I would like to say that surround yourself with people who are much more senior in the position in the field,
Mhm.
and try to mimic how they are trying to work,
Yeah.
and try to revolve around their network, because that is
Yeah.
something which will open your doors.
Yeah, absolutely. Thank you so much. That was such a wonderful thing. Just to add for a last question to you, you know how our organization, we are just babies, we've just started. And this is mainly for the graduate students, students like me or students like who have just enrolled or already in their second or third semester. The main goal of this organization is to connect all of these students to alumni like you, or people who are already there in the industry and doing so much. What is that one take, or what is one advice that you would like to give to our organization that we've just started? What is something that we can do to improve ourselves, or to do something better, just to help students like us? Or yeah.
I think the only thing which is to try to understand and try to find out gaps which all of them are facing,
Mm-hmm.
put it in one particular basket and look for answers for those particular problems, because
Yeah.
everyone has so much of queries and doubts. So
Mm-hmm.
with this particular organization, so many things can be conveyed.
Yeah. Absolutely. Thank you so much. It was such a wonderful conversation. I think this was one of the first time that we ever sat down and had conversation on at such a professional level.
Yes.
There were so many things that I learned that
Yes.
I don't think I would have ever asked you in a normal conversation. So thank you so much. This was absolutely great. I appreciate you taking out your time and contributing your thoughts, because when people say health informatics, when people say Hofstra, uh, people of course take your name. You are somebody who is just all over the place. People know you because of your networking skills. So thank you so much. I really appreciate it. Thank you, viewers. I just hope that this podcast helps you and it solves all your questions, it answers all your questions. Stay tuned, be innovative, and we'll see you on our next series.